Continue with that discussion. Is this the fifth wave? Well, despite the spike in infections, the health department says no. The country reported over 9,000 new cases and 7 more deaths, as we just mentioned. Let's discuss the surge in numbers with Professor Francois Venter, who is from the University of Wits. Thank you so much for your time, Professor. We do appreciate it. It seems as though the numbers are increasing on a daily basis. We do know that the positivity rate has shot up quite dramatically. Is this cause for concern?
Yes, I think that there's good evidence that we're starting to enter the fifth wave. It's looking very similar to a year ago. It's the same time period. It's starting in Gauteng like the same time a year ago. The pattern's very, very similar. So it's very worrying that we are entering the fifth wave.
Yes, so you mentioned that we are entering the fifth wave, but do we know if there is any new variants or if it's still sub-variants of Omicron, and it seems as though infections still remain relatively mild compared to what we've seen with other variants like Delta and the Beta variants?
So there is evidence that it's a subvariant. It's even more infectious than the Omicron subvariant that hit us in December, and has been running around the world at the moment. The B2 was the initial one, now the B4 and B5, and there is evidence that that's what is present in South Africa, and is probably going to be responsible for the fifth wave and is responsible for much of the rest of the world's infections. So if it does prove to be the fifth wave, I think we can anticipate it's going to be B4 and B5, a subvariant of Omicron, which is significantly more infectious than B1, which was responsible for what happened in December, which was by itself incredibly infectious. So it's not good news, for the country, is that we are, if this is truly a fifth wave, and as I said, it looks pretty likely, we have something very similar to what happened. I'd be cautious about saying it was less severe than Delta and what we saw a year ago, which was pretty catastrophic. What happened in Delta is what you see with infections and is a form of vaccination. People get it and survive it, and they have a form of immunity that stops them from being hospitalized and dying. People who haven't been vaccinated or didn't get it, with previous waves, are still very, very vulnerable to getting sick and dying. So the message is still the same thing. Try not to get it. And your best way of doing that is, the best form of protection is get vaccinated and then pay attention to, the boring stuff that we've been preaching the whole time, which is sort of ventilation, and, if you're exposed to, is try not to get exposed to people with symptoms.
Yes, certainly. I mean, just because it seems as though people want to believe that this time around it's a lot milder, it's got a lot to do with the fact that people are now vaccinated. And I certainly would not want to get COVID again, because the long COVID is something very difficult to deal with and overcome. I want us to speak about the deaths, though, because we are still seeing deaths being recorded on a daily basis. Yes, it's not as dramatic and as severe as what we saw in early stages of the COVID-19 pandemic, but people are still passing away from COVID-19 complications. What does this speak to? Does it speak to people not being vaccinated? Does it speak to people having comorbidities and being vaccinated but just passing on from the virus? What does it actually tell us? Do we know?
I know 2 people who have died in the last 10 days of COVID, and I think that we just need to anticipate this is a really vicious virus. People keep saying this is just flu. It really is not. It's still something we're grappling with. It's still taking out people despite vaccination. Vaccination provides a huge amount of protection, but for people with comorbidities and in the elderly, it still seems to be able to pick off people. And for that reason, we still need protections for those people. We still need to. We're looking at a whole new range of drugs, which we might be able to give people to offer an additional layer of protection on top of the vaccination. It does seem as if there's a limit of protection to which the vaccinations are able to provide to those people. We're hoping that more vaccinations will provide more protection, but there might be a limit to that. So we may need these drugs to come on board. And we may need those people to be even more careful during these surges and these waves that come along. So I was kind of hoping by this stage, we could have got to the stage where it became just a recurrent respiratory infection, but we haven't reached that stage yet. It's still picking off people. It's still causing a significant amount of illness. We know we're close to where we were a year ago when that Delta wave killed so many people and the waves prior to that. But we're still not at a steady state where we can all sort of go back to normal and just ignore the virus. We still have a lot of work to do in terms of working out how best to protect ourselves, and medicine has a lot to do in terms of trying to find out some interventions that can protect the most vulnerable in the society.
Now, Prof, I think what's still very concerning for government, and I think any South African that is vaccinated, and you still have people who have opted not to get vaccinated for whatever reason it might be, government is still at pains to try and get any message across to people who have not been vaccinated or have not opted to go for their booster jab. How important is it for people to do so? And I ask this question in the context of people almost being, and I'm going to say this in what I've been hearing, almost over COVID, and they don't believe that COVID still exists, and they don't think it's as serious anymore. But the need is still to be vaccinated or boosted, isn't it?
Yes, and I think we're all sick of it. I think we're all over COVID, and I think we all just want our lives back. We all want to be back 2.5 years and, to just get back to where we were. Unfortunately, there's no shortcuts to this. We need to get immunity. And even if you've had COVID, it's quite clear that vaccines add the next layer of protection. It's like being in a car. You can have the seatbelt and you need to drive carefully, and you can have more and more layers of protection on top of that, and you can have better airbags and everything on top of that. Just getting the vaccines on top of infection just adds those layers of protection on top of that. And you talked about long COVID. It's not just about dying and or going to hospital. It's also about long COVID. And I think we're seeing that the disabling effects of COVID are quite severe for different people. We're getting terrible reports of people being just having all sorts of memory problems. You talked about your own experiences. It'd be my experience too. And the people around me, that I was quite shocked at how badly the effects of COVID were, despite being vaccinated. So the point is just protect yourself. The vaccines are very safe. Don't believe the reports. There's no such thing as a completely safe drug or a completely safe vaccine. There are tiny, tiny numbers of people who have side effects. So let's put that on the table. But the virus itself is much more vicious and will give, the side effects of the virus are far, far, far outweigh those of the vaccine. So just comply with the guidelines, get the vaccine, get yourself vaccinated, listen to what the government guidelines are doing, and just get out there and get vaccinated. There's no such thing as a safe way to get the virus. Your natural immunity is not going to protect you like this. It's not a good way to get immunity. The vaccines are just a much safer way of doing that.
Certainly, and I can remember when I first got COVID, I was like, I'm young, I'm going to be okay. I was more worried about my parents, but the issue here is that long COVID has been very difficult to deal with because it's the exhaustion levels, it's the memory loss was such a big one. So that's why everybody's being urged to just be extra cautious. I want us to move over to, if I can call them the new COVID regulations, even though not much has changed. But there's been a lot of criticism that the Department of Health almost left it to the last minute to almost gazette new regulations under the National Health Act. And there's a big issue and concern around how the mask issue is confusing people, because you don't have to wear a mask outdoors, but when you get indoors, you do have to wear a mask, and people are saying, well, what's the actual point? Do you think these new regulations or these amended regulations are actually going to help in preventing the spread of COVID and are helping in any way when it comes to this new increase of infections that we are seeing in the last couple of days?
So I reread them this evening in preparation for this interview, and there's no other way to describe them than they are a complete mess. They just make absolutely no sense. They're almost written by somebody who was in a time capsule for the last 2 years, hasn't paid attention to the science. There are a whole range of regulations that are not based in science. They're not based in the experiences of the last 2 years. They don't take cognizance of the fact that this new variant is so transmissible. It is, everything from the border crossing regulations and the testing regimens that they have to the issues around quarantining and isolation to the, as you say, the mask stuff is just a mess. And the communication from the Department of Health, I think that you've seen that has been around masks in the classrooms, is testament to that. And it's really disappointing that our government just hasn't got this right at this stage. They really should be focused around protecting the health facilities, protecting the vulnerable, which includes children who need to get their schooling back as quickly as possible, as safely as possible, and needs to be more conscious about how they communicate this stuff. And they just haven't done that well. It's really frustrating that this continues to be, so badly communicated. It's also really frustrating that it's so slow. This virus, if this is the fifth wave, and we've already seen the numbers screaming up in Gauteng, it'll be 3 or 4 weeks and we'll be over the fifth wave in Gauteng. By the time they finish consulting and talking to everybody, it'll all be over with, and we can then wait till December to finish the consultation process. We don't have time for these convoluted processes. We have enough expertise to actually put this forward. And, there really needs to be some introspection within the Department of Health about how they take these processes forward. As I said, South Africa has some of the best pandemic experts in the world working here. I don't understand why they don't use their expertise and use it better.
And I think that was going to be my next question, to say to you, what happens now moving forward with these new regulations? Because we know the public comment part has been extended until the 5th of July, if I'm not mistaken. And many are saying, well, what's the point? Because you've already made up your mind with certain regulations and they aren't actually working. And people are becoming a lot more resistant to government's proposals of these new COVID regulations.
If you look at the patterns and the waves that we've had in the last year and a half, you could argue that government regulations have done diddly squat in terms of the impact on the waves. And there are things people can do to protect themselves. There are things, good public health advice can do to help just mitigate some of this stuff. But those regulations are an absolute disaster, and there's been many attempts to try and modify how government looks at these regulations, and it just seems like they're just not listening at the moment. And watching the ways to try, different Department of Health officials trying to explain the masks in the classrooms over the last 2 days and then backtrack on it all, that sort of public health messaging is a mess. Masks are just one part of our armamentarium in terms of dealing with the virus, and not a great, the kind of masks that people are wearing on an everyday basis are really not useful in terms of dealing with Omicron variant. You need proper masks, and you need to wear them properly to really deal with this variant. We need to be paying much more attention to open windows and open doors. Unfortunately, government has just focused on the masks. And then we have number curtailment outdoors, which is probably your best protection. It makes no sense whatsoever. As I said, it's almost like somebody way back in early 2020 has written these regulations and put them out there for comment.
And it seems as though there's no room to maneuver, and it becomes very difficult when you have these public comments open, but it almost seems as though they aren't being considered. So it's going to be interesting to see what happens come the 5th of July and thereafter. Thank you so much for your insights and making time to speak to us this evening. That was Professor Francois Venter from Wits University. Now let's move over to this story. The Guardian